In this short video, we will be discussing about optic disc swelling. The optic nerve is made up of 1.2 million nerve fibers from the retinal ganglion cells. It transmits visual information from the retina to the brain. In turn, the optic disc is actually the intraocular portion of the optic nerve. The retina and optic nerve are extensions of the central nervous system, and in fact, they are the only structures of the central nervous system that can be directly visualized. Thus, they are known to be windows to the brain. Recognizing optic disc swelling is important because not only a patient's vision but also maybe life depends on a timely diagnosis. This is the normal appearance of the optic disc during ophthalmoscopy examination. Note that the color is pinkish with well-defined margins and the presence of a central depressed area which is lighter in color, which is called the optic cup, where the retinal vessels penetrate. Apart from examining the appearance of the optic disc, there are several tests that can be performed to evaluate the optic nerve function. They are the relative afferent pupillary defect, visual acuity, color vision, light brightness, red desaturation, visual field, and also contrast sensitivity. Now let's move on to optic disc swelling. Optic disc swelling is the elevation of the optic disc and the blurring of the borders. It can be associated with other findings such as peripapillary hemorrhages, macular exudates, tortuosity of the vessels, and so on. It can be caused by either direct injury or insult to the optic nerve, which is optic neuropathy, or increase in intracranial pressure, which is papilloedema. These two are called true disc swelling. There is another condition in which the optic disc appears to be swollen, but in fact it is not actually swollen. It's called pseudopapilloedema, which is caused by optic distrusion, myelinated nerve fiber layers, tilted disc, or hypermetropic or myopic disc. These two pictures show the appearance of an optic disc swelling. The picture on the left shows the elevation of the optic disc margins and also the blurring of the margin. As you can notice here, it is not as well defined as in a normal optic disc. The picture on the right shows the elevation and the blurring of the optic disc margin in addition to peripapillary hemorrhages and also tortuosity of the vessels. So, what are the causes of optic neuropathy? The list is extensive, as can be seen from this table. In contrast to optic neuropathy, where there is direct damage to the optic nerve, papilloedema is optic disc swelling caused by raised intracranial pressure. It is usually bilateral, and the most common cause is due to idiopathic intracranial hypertension. Other conditions that cause increase in intracranial pressure can also cause papilloedema. Pseudopapilloedema are not true disc edema. They are mainly due to structural anomalies and are mainly unilateral with normal visual function. The most common cause of pseudopapilloedema is optic distrusion, which is hyaline deposit at the optic nerve. It has a lumpy appearance, and on ocular ultrasonography, it appears as a hyperechoic lesion due to the high calcium content in it. Another cause of pseudopapilloedema is myelinated nerve fiber layer. A patient with optic disc swelling, full ophthalmological and neurological examination must be performed. Now, the next question is, what type of optic disc swelling that this patient is having? In general, patients with pseudopapilloedema will have unilateral optic disc swelling with normal visual function. The diagnosis can be confirmed by using optical coherence tomography, ocular ultrasound, or fundus fluorescent angiography. Patients with papilloedema usually have bilateral disc swelling with normal visual acuity initially and normal color vision. Patient might have enlarged blind spot or constriction of the visual field. Patient might also have signs and symptoms of increased intracranial pressure such as headache, nausea, vomiting, tinnitus, diplopia, and so on. Patients also might have some focal neurological symptoms. Patients with papilloedema must undergo neuroimaging to look for underlying pathology. In the absence of any space-occupying lesion, lumbar puncture can be performed to look at the opening pressure and also for CSF analysis. Patients with optic neuropathy usually have unilateral optic disc swelling. They have reduced visual acuity and color vision. Patients may have central, arcuate, or altitudinal visual field defect. Patients might also exhibit signs and symptoms of underlying disease. For example, pain on eye movement in patients with optic neuritis, or jaw claudication, scalp tenderness in patients with giant cell arteritis. And appropriate investigations are done according to the underlying disease. For example, neuroimaging in optic neuritis, ESR, temporal artery biopsy in giant cell arteritis. So the most common cause of unilateral optic disc swelling with normal visual function is optic disc drusen. And the most common cause of unilateral optic disc swelling with impaired visual function, it is demyelinating optic neuritis in young and non-arthritic ischemic optic neuropathy in the elderly. Whereas when we have bilateral disc swelling, we have to determine whether it is papilledema or bilateral optic neuropathy. And this can be done with proper history, examination, and investigation. Take-home message is optic disc swelling should not be missed during ophthalmoscopic examination because the differential diagnosis for optic disc swelling is extensive, ranging from the benign to the sight and life-threatening. And you have to always remember that optic disc swelling might present in patients with normal visual function. And patients with symptoms of increased intracranial pressure should undergo ophthalmoscope examination to look for papilloedema.